Hi, do you ever get pain in your shin, the front of your ankle, or even down into your big toe? If so, this could be coming from trigger points in the tibialis anterior muscle or anterior tibialis. Hi, welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to go over trigger point release of the tibialis anterior muscle, which is located on the front of the lower leg. If you've ever experienced shin splints or shin pain when running, walking, this muscle can be a culprit. Before I begin, I want to speak a word of life from Proverbs 29:11. Fools give full vent to their rage, but the wise bring calm in the end. All right, so this is something that I've known all too well with shin splints, also known as anterior compartment syndrome. So when you are running or walking and you're controlling that heel contact as the foot comes down and you're pulling that foot up into what you call dorsiflexion, so you're flexing the foot, you're constantly using the tibialis anterior muscle. And what can happen is that compartment, the muscle can be inflamed, it can swell, and it can eventually, if it gets bad enough, can press on the deep peroneal nerve, which is the branches of L4 and L5. So that's the nerve supply to that muscle. And you can end up getting drop foot if that nerve gets compressed. So if you've got problems in this muscle, if it develops far enough into full-on inflammation, that compartment has a fascia connective tissue wrapping, so it can entrap all that swelling and press on that nerve, and you can end up with drop foot. So you want to address the pain on the front of the lower leg if you start to feel it. The sooner you address it, the less likely it will become chronic. So we want to address that muscle. I'm going to show you how I release that muscle as well as stretch it, and then you can strengthen it. However, if it is an overused muscle, I'm a little wary of strengthening the overuse of the muscle and more focused on releasing the fascial tension as well as the trigger points in the muscle. And then if you've got really tight calf muscles, this muscle can actually work against the tightness in the calf. So stretching the calf can help calm down the overuse of the anterior tib, trying to fight against that. So this is going to be trigger point release of the anterior tibialis. So that muscle is going to run from the shin bone. So it's going to be on the tibia. So I've got my shin bone here, this meat of the tissue. It's going to be attached to that tibia. It's going to come down and it's going to go and attach into my medial cuneiform, so one of the midfoot bones, and then the base of that first metatarsal, so inside the foot. And that motion is it's going to pull the foot up, and then it's going to supinate. It's going to invert the foot, so you're going to pull that foot up and then invert the foot, and that is going to activate the anterior tibialis, and this is going to be my tendon that is going down and attaching into the foot there. So to release this, I'm going to use a single lacrosse ball. You can do this with a foam roller, you can do it with a double lacrosse ball, but with the single lacrosse ball, what I'm going to do is I'm going to apply pressure to that muscle, and I'm going to focus mainly on the upper portion where the meat of that tissue is, and I'm just going to work my way down towards the front of the ankle, but I'm not going to go over bone. So I'm going to usually spend most of my time up here, and I'm going to apply body weight. So if I'm going to release the tension on this, or the trigger points and the tension on the fascia on this side, I'm going to place my lacrosse ball and I'm going to put pressure here. I'm going to angle slightly towards the side so that I am not going to put pressure on the bone and that I'm going to be on the muscle. So I'm not on my shin bone, I'm on the muscle here. And then I like to go into my elbows for the stability here and just slowly work my way down that muscle. And I will hang out anywhere I feel any tenderness or tension. It takes about 20 to 30 seconds over a trigger point, but spending 2 minutes so that I can also mobilize that fascia, that connective tissue that wraps around the muscle, and mobilize that. And then what I can do is I can take my foot and I can bring that foot and pump it up and down. And that's just to give some active movement there as I release the tension. And I'm just going to hold, work on that area. After I do the release, I'm going to stretch that muscle. One way to stretch this muscle is just to put the top of my foot flat onto the floor and sit back to see if I get a stretch there. If it's really tight, you will get a stretch just going into this position. Or what I can do is I'm going to cross my leg over, and I want to keep my ankle in a neutral position, and I'm just going to point my toe, and I should start to get a stretch across the top of the foot. And then if I'm really tight, I'll get the stretch right through there. So on that shin. So sitting back, stretching that anterior tibialis after releasing the tension. And then to strengthen it, I can use a TheraBand. And you can do this in different positions, but the idea is that you want to do resisted dorsiflexion and inversion. So I'm just going to hold tension with my opposite foot. And so if you can see, I'm going to do this on this leg. I'm just going to push tension down, and then I'll work on pulling that foot up and dorsiflexing that foot just to strengthen the anterior tibialis muscle on that leg. So I'm just lifting up and then relaxing, lifting up and then relaxing. I can also do this with the leg straight and pulling back against resistance, and then relax, pulling back against resistance. I can even do this in standing. So if I want to stand, I can just keep that down and then lift up against resistance, and focus on the strengthening there. But again, if you're having discomfort or pain, I would focus on releasing the trigger points and stretching the muscle, and not to strengthen if there's pain. So the strengthening only happens if you can do that in a pain-free range, because you're getting a lot of contraction in that area if you're getting any foot slap or getting pain in that muscle. So that is the trigger point release of the tibialis anterior muscle. I hope this is of help, and have a blessed day. Thank you.